Good day, everyone. Welcome to this session. We will continue our discussion on respiratory risk and breathlessness in telehealth care. In our last session, we examined why breathlessness is high risk. We learned that breathlessness is dangerous because it may indicate serious conditions. In telehealth, it is harder to assess, so it must be treated as a risk signal, not just a symptom. Lastly, we also discussed why respiratory risk is amplified. We learned that risk is higher in telehealth due to 1. Limited assessment. 2. Delayed emergency response. 3. Patient limitations. 4. Rapid deterioration. 5. Estimating severity remotely. Now, we will move on to the main focus of this session. By the end of this session, learners will be able to 1. Identify silent hypoxia and a looks fine trap by flagging high-risk cues in a scenario. 2. Recognize atypical respiratory deterioration signs such as confusion, falls, functional decline, and state escalation triggers. Let's begin with, what is silent hypoxia and why is it dangerous in telehealth? Silent hypoxia refers to a situation where a patient has dangerously low oxygen levels but does not appear as distressed as expected. In telehealth, this creates the looks fine trap, where a patient appears better than they truly are. The clinician must not allow a calm appearance on video to override a concerning clinical story. This is dangerous because the patient may look calm, speak normally for short periods, appear not too bad on video. Why can this happen? It can happen when 1. Gradual deterioration allows temporary adaptation. 2. Older adults may show less obvious distress. 3. Chronic illness can blunt visible responses. 4. The camera may hide effort. And lastly is, sitting still may make breathlessness less obvious. Note: if the history suggests serious respiratory risk, normal-looking video appearance should not provide false reassurance. The next thing we will look at is what atypical signs may suggest respiratory deterioration when breathlessness is not obvious. Respiratory deterioration does not always present with dramatic breathlessness. In older adults and vulnerable patients, the earliest signs may be indirect. These symptoms may be wrongly explained as stress, weakness, aging, or fatigue when the underlying problem is actually hypoxia, infection, heart failure, or pulmonary embolism. Important atypical signs include 1. New confusion. 2. Delirium. 3. Sudden functional decline. 4. Falls or near falls. 5. Reduced oral intake. 6. Unusual tiredness. 7. New drowsiness. 8. Withdrawal from normal activity. 9. Family reports that the patient is not themselves. Note: in telehealth, these indirect signs must be treated seriously. Moving on to the next is, how should clinicians think about respiratory differential risk in telehealth? Telehealth respiratory reasoning is safer when the clinician thinks in risk categories, not only in exact diagnoses. Important high-risk categories include 1. Acute hypoxia or respiratory failure risk. 2. Pulmonary embolism risk, such as sudden breathlessness, pleuritic pain, syncope, leg swelling, and recent immobility. Number 3 important high-risk categories is acute heart failure risk such as orthopnea, nocturnal breathlessness, swelling, and reduced exercise tolerance. Number 4 is severe asthma or COPD exacerbation risk, such as wheeze history, inability to speak, and poor response to inhaler. Number 5 of important high-risk categories is pneumonia or sepsis risk such as weakness, confusion, reduced intake even if fever is absent. 6. Medication-related respiratory depression risk such as opioid or sedative use. Note: the clinician should ask, what dangerous respiratory category could this fit into, and can I safely manage that risk remotely? In conclusion, we learned that silent hypoxia means the patient has low oxygen levels but does not look very sick. In telehealth, this is dangerous because the patient may appear calm on video, yet be seriously unwell. We also discussed about respiratory risk in telehealth. We learned that clinicians should think about what serious condition this could be, not just the symptoms. We have come to the end of this session. Thank you for watching. See you in the next session.